The Frequencer V2x was invented by Louis Plante. Louis is a CF patient. He once went to a rock concert. He was standing close to a speaker, and the vibration of the sound made him cough so much, so he had to leave the room. So when he came back home, he made the connection between sound waves and airway clearance. So that's the technology behind the Frequencer. It works with sound waves. The Frequencer is an airway clearance device, and it works with sound waves. An interesting study was done at the University of Paris. It was comparing how mechanical and acoustical waves are traveling throughout the chest. What they found out is that mechanical waves are strong where you apply them. As they travel throughout the chest, they're going to diminish rapidly. While with sound waves, it's the opposite. Very gentle where you apply them. As they travel throughout the chest, they're going to diminish less rapidly. So since sound waves are traveling throughout the chest, you just need to treat the front wall of the chest. So that's going to be very convenient for patients at home, since they're going to be able to do it by themselves. And in a hospital setting, normally patients are in a declined position. Sometimes they're unstable, hard to mobilize, or they have a lot of tubing. So the Frequencer is going to be a good option because you're not going to need to treat the back, just the front wall of the chest. The Frequencer is also very gentle. Force is measured by Newton. When we do conventional chest PT, we generate 58 newtons each time the hand hits the chest wall. The Frequencer only generates 1.8 newton, so it's very gentle, very well tolerated by peds, older frail patients, and patients that just had surgery. And you can also treat the whole chest area, but be specific at the same time. So let's say the RT sees that the patient has more sputum on a specific lobe. We can spend more time over there and have a precise therapy. So to provide therapy with the Frequencer, the first step is to select the correct adapter. So mainly the goal is to take the largest adapter we're able to have a seal with and to put it on the transducer and make sure it's tightly sealed. Once we're ready to generate the therapy, we have two settings to adjust: frequency level and treatment intensity. The frequency is measured in hertz. It's the number of cycle per second. It goes from 20 to 65 hertz, but by default, when we open the Frequencer, we have a default setting at 40 hertz. There's a reason for that. Two independent studies have shown that the resonant frequency of the lung, so this is where lung tissue is going to vibrate at its most, it's around 40 to 42 hertz. So when we do airway clearance techniques, mainly what we're trying to do is to generate a frequency. So when we do chest PT, we generate 4 to 6 hertz. The vest goes from 12 to 19, while percussors are around 15. With the Frequencer, we start at 20, but since we know the optimal frequency is around 40 to 42 hertz, we're going to stay in that range for the therapy. The other setting is treatment intensity, measured in percentage, goes from 0 to 100, and we change it depending if we're treating a baby, a child, or an adult. That's very easy to set, depends on patient's comfort. So for example, if I'm treating a patient at 75%, if the patient thinks it's too strong, I'll decrease it. Not strong enough, I'll increase it. If the patient is comfortable, I'll leave it like that. Concerning the treatment, depending on patient needs, once to twice a day, 15 to 18 minutes total treatment time by using 6 different positions on the chest. So we have the sternum and the ribs here. So position number 1 would be 1, 2, 3-4 for men. For women, you would come under the arm, and 5-6. So that would cover the whole chest area. And we want to start from the bottom and work all the way up. The goal is to dislodge sputum, bring it in the upper airways, and make it more liquid. When it's time to provide therapy, simply hit the start button. You can put the transducer on the chest, and that's it. Your therapy is on. So we can put it directly on skin or on a thin fabric. A hospital gown would be perfect. And also, two things you want to make sure you have while the patient is receiving the treatment. First of all, you should hear the voice shaking. And the second thing, if you put your hand on the back, you should feel sound waves are traveling through. Adapter number 1 is for babies in the NICU. The transducer is going to stay outside of the isolate, and sound is going to transmit all the way through to treat the baby's chest. Then we have 3 other adapters. Adapter number 2 for peds, and adapters number 3 and 4 for adults, depending on the size of your patient. For patients at home, the Frequencer comes in a black carrying case. So in a hospital setting, the Frequencer comes on the roll stand with single patient use disposable adapters with filters. So these adapters are not to throw in the garbage after each treatment, but between each patient. So the Frequencers on the stand travel from a patient room to another, and those would stay at the patient bedside, and they're good for the whole duration of their stay. To operate the Frequencer, plug the power cord in the wall and the power cord in the power supply. When it's time to put the Frequencer on its stand, there's a metal plate under it, so you simply have to slide it. And use the white screw to stabilize the unit. Take the cord, plug it in the Frequencer, and just push on this button, and the Frequencer is ready to go.